Hi, my name's Vicki. Welcome to Living with Sjogren's Disease. I wanted to talk to you today about Naltrexone, what it is, what it's for, and even more importantly, what low dose naltrexone and very low dose naltrexone is. I wanted to talk to you about what it's used for, how it's used, the doses prescribed, the benefits for inflammation, pain, fatigue, gut issues, how to get it, what it costs, all those things. Just a disclaimer, I did not know about naltrexone. I hadn't heard of it before. I may have heard it in nursing school during the pharmacology segments of school, but it's not a medication that I've ever taken or worked with before. I'd never heard of low-dose naltrexone, and I had no idea. In the beginning, when I first started looking up this information, I had no idea that what naltrexone was used for could be applied to pain and fatigue and these sorts of things. And so it was very interesting research. Let's get started. So naltrexone has been used for 30 years or more for treating addiction, the cravings that come along with addiction. And how it does it is naltrexone enters into your system and it binds to various receptors that are attached to nerve cells. Many of them are in your brain. In fact, most of the ones that are involved in addiction are in your brain. And naltrexone acts like opioid, like an opioid substance. So it's really, really attracted to any of those receptors that are on the nerve. So it comes along and it binds to them. And the nerve receptors accept it. The difference is the naltrexone doesn't allow triggering of those nerve fibers. It isn't sending any signals. So as long as the naltrexone is sitting onto those receptors, nothing's happening. And as long as it's there, it's blocking the ability of opioid substances from binding. Now, opioid substances act like a happy chemical, like endorphins say. They act like a happy chemical. And so as long as there's nothing on these receptor cells of the nerves, they're saying, we need substance, and so along comes naltrexone and binds to it. So that makes them happy, but without triggering more continued desire to be driven towards those substances that a person may be suffering from addiction from. But here's the thing. For addiction, the person has to go through detox first and then start naltrexone. If they don't go through detox first, the naltrexone being bound to those receptors will send the person into withdrawal. So after a person is detoxed, they can use the naltrexone and that decreases their cravings. So let's talk about low dose naltrexone and what it is used for. Well, it's not FDA approved specifically for these uses, which I guess I shouldn't be surprised at that. There are not enough studies done to scientifically prove its effectiveness, what it does, how it does it. Right now, providers who are prescribing it for off-label use. But to me, as long as it's able to be prescribed, I think that's the important part. So low-dose naltrexone is very, very low dose in comparison to naltrexone. It's about 1/30th the dose. So low dose and very low dose naltrexone are prescribed at starting at 1 milligram and then moving up to 1.5, then 3 milligrams, and eventually can go up to 4.5 milligrams. And so when you first start low-dose naltrexone, you'll be started on a very low dose in that range between 1 milligrams and 4.5 milligrams. It just doesn't take as much. And so there are many theories about how low-dose naltrexone works. Let's just call it LDN from this point. There are theories about how it does what it does, but let's talk about the benefits and what it's been shown to help with. So pain, chronic fatigue syndrome, autoimmune diseases, so systemic inflammation, so fibromyalgia pain, the lack of signaling coming from the brain to the muscle cells, that helps with that, to help increase a person's ability to use energy and move and function. For autoimmune diseases, it decreases systemic inflammation. It helps with brain fog, fatigue, skin issues, gut issues. I have a list here. Pain, fibromyalgia, chronic fatigue, autoimmune and inflammatory diseases, diabetic neuropathy, MS, Parkinson's disease, systemic inflammation from lupus, Sjogren's, Crohn's disease, just so many uses, and so many benefits. Headaches, insomnia, cognitive impairment, depression, environmental sensitivities, digestive symptoms, skin complications, exercise intolerance, deep fatigue, brain fog. This enough right here has me convinced that I need to try low-dose naltrexone. There are many reports in the research that I read about. While doing my research, I read about many reports of how helpful and beneficial this medication has been. There are YouTube videos where patients have come on and talked about what their experience with it was like. And out of all of those, I've never heard any of them, I never watched any of them say, oh, this medication wasn't for me. Which begs the question, why haven't any of my providers mentioned it to me with the chronic complications that I have? Is it related to the fact that it's not FDA approved, that the research hasn't been proven by scientists out there and researchers? Even though there's theories, what is the case? Could it be drug companies that don't want to share the spotlight or the stage with low-dose naltrexone, or who want to continue making the money that they make from manufacturing medications? Now, I would never fault any company or any person for making money. Money makes the world go round. It provides for our needs. It provides a lot of joyful things. But when making money interferes with promoting the best health and healthy living that we can, that's an issue. And that's a question that I have regarding low-dose naltrexone. The research I found shows that it can be as inexpensive as $1 per day. Yes, so if you take 1 dose a day of low-dose naltrexone, it's going to cost you as low as $30 a day. Here's the thing, the fact that it's not FDA approved specifically to treat inflammation or chronic pain or chronic fatigue, it means that insurance companies may not be willing to pay for it. Yet, I spend at least $30 a month or more just on supplements. I would definitely, if I had to, I would be willing to pay $30 a month, even $40 or $50 a month for something that was going to help me get some of my life back, my quality of life back. It is reported that LDN and VLDN have been really well tolerated and that there are little to no side effects experienced. Hurrah! That's awesome. So that's another big plus. So once a person starts to take LDN, how long does it take for the medication to kick in? I think it kicks in pretty quick, pretty fast. The thing about it is it's got, I think, a 4-hour half-life. And so I would think that anywhere from 4 hours to 16 hours, I think it would continue to work while it's in your system. And even though it can come into your system and bind to receptors, it will only stay bound for so long before it wears off and dies out and goes away. And so how it gets out of your system is that most of it is metabolized by the liver, and a little bit of it that may get left over is excreted in urine. So kidneys take care of some of that, and it just gets peed out, and the liver takes care of the majority of it. So I never did find information about how it absorbs into your system. If you take it as a pill, does it get absorbed through your stomach or your lower intestines? That makes a big difference, because if it gets absorbed in the stomach, that means it needs an acidic environment to get absorbed. And so those of us who battle acid reflux, if we're taking a lot of acid reducers and it needs to absorb through an acidic area like in the stomach, reducing the acidity is going to reduce the absorption of the medication, which will decrease the function and decrease the benefits. It won't work as good. If it needs to absorb in the small intestine, where it's more of a basic environment, and we battle, say, Crohn's disease or IBS, where the acidic stuff is just irritating our bowel and shooting it all through, then it's not going to have as basic enough environment to absorb. It also won't have enough time to absorb as it goes through the small intestine. It takes time for that. And so those are two issues that I think would maybe need to be considered in treatment with LDN. Although, because it's been shown to be effective for Crohn's disease and IBS, that leads me to believe that maybe it needs an acidic environment like the stomach. The information I did find said it can be taken in pill form or as an injection. So, but I don't know about I didn't find that on low-dose naltrexone. So if you know that low-dose naltrexone can be given as an injection, please drop a note in the comment box and let us all know. Let me know, because that would be beneficial from me, since I always have such high acidity in my stomach. You know, having an alternative way to take the medication would be beneficial. So yeah. Say hi, Lucy, say hi. Say hi. Oh, I just want to play. I want to play. Yes, yes. So low-dose naltrexone seems to me that it's a very well-rounded medication that can treat many aspects that, you know, of a chronic illness. People with chronic illness suffer from multiple conditions, and with naltrexone, or low-dose naltrexone, being so beneficial in so many different ways, I just would think it should be an absolute staple for treating anything rheumatological. But for me, it doesn't seem to have been. So I have an appointment coming up in May, about the middle to the end of May, and I'm definitely going to talk to my provider about low-dose naltrexone, and I'll find out, is it something my provider is willing to prescribe or unwilling, and hopefully they will explain to me why. I did see on a YouTube video that the person I was watching did say there are ways to get low-dose naltrexone even over the internet. So I will link my resources in this video, and they will be at the top. And they'll each be labeled, and there should be a link with each one of them. The ones that I can't put a link with, I will list the website of where it came from, so that you too can reference those things. I hope that you'll check out some of those other videos. I'll link one right up here that I watched, and it was fantastic. This one is a patient talking about her experience on it. And she also was a big factor in my realizing that this is a medication I need. It's a medication that it flusters me that none of my providers, neurologist, rheumatologist, primary care, none of them have ever mentioned this medication to me. And I'm not sure why. You know, if it's because it wouldn't be approved by my insurance, is it because they don't prescribe that at their particular group? Or because they don't believe in it? I don't really know, but I'm going to find out. I just would like to know, you know, if there's something that awesome out there that has very little side effects and has been shown to decrease systemic inflammation anywhere between 30 and 50% or higher, that's worth it to me. I would think we would need to be doing a lot of detailed studying about it. So I hope that that's what happens for the future, and stay tuned for the more technical explanation that's non-technical, I guess. So I'm ending this video here because it's already too long, and I will attach above my explanation of low-dose naltrexone mechanisms of action, how it does what it does. Thanks for watching.